2022 has been another very challenging year for the health of the world's people. The third year of the COVID-19 pandemic, a global outbreak of Mpox, an Ebola outbreak in Uganda, wars in Ethiopia and Ukraine, cholera outbreaks in multiple countries, drought and flooding in the Greater Horn of Africa and the Sahel, flooding in Pakistan, and numerous other health emergencies. That's not to mention the multiple other threats to health that people face year in, year out, in the air they breathe, the products they consume, the conditions in which they live and work, and in their lack of access to essential health services. As 2022 draws to a close, we still have many reasons for hope. The COVID-19 pandemic has declined significantly this year. The global monkeypox outbreak is waning, and there have been no cases of Ebola in Uganda for more than 3 weeks. We're hopeful that each of these emergencies will be declared over at different points next year. Certainly, we're in a much better place with the pandemic than we were a year ago, when we were in the early stages of the Omicron wave with rapidly increasing cases and deaths. But since the peak at the end of January, the number of weekly reported COVID-19 deaths has dropped almost 90%. Gaps in our understanding of how this pandemic began compromise our ability to prevent future pandemics. We continue to call on China to share the data and conduct the studies we have requested and which we continue to request. As I have said many times before, all hypotheses about the origins of this pandemic remain on the table. WHO is very concerned over the evolving situation in China, with increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
The rates of vaccination in China, while on the face of it are high, they still lag behind in terms of overall coverage, particularly when you look at people over 60, particularly when you look at full vaccination, which I think in the case of the available Chinese vaccines would likely be 3 doses of vaccine as a primary course, not 2 plus a booster. And I think we're talking, protective efficacies of hovering at 50% or less for those 2-dose regimes in someone over 60. That's just not adequate protection in a population as large as the population of China. In such a large population with so many people in a vulnerable setting, with that coverage, we really have to focus on vaccination. Having said that, China made massive progress over the last number of weeks in actually rolling vaccines out. I think there have been a 600% increase or more in vaccination rates over the last week or 2 weeks. I don't think there was a switch off, and that switch off has caused this rise in transmission. This is one of the single most transmissible variants we've ever seen as Omicron. We have a vulnerable population, and the virus was going to spread in this way around the country. And it's not fair to say that China has lifted all its restrictions. I think there are many public health measures still being applied, but what they've lifted, I believe, were the more stringent of those requirements that were really putting pressure on people in their normal lives, in their normal pursuit of life and livelihood. 1 in 7 people on the planet live in China, and the acceleration of vaccination, the protection of the health system during this period is in the interest of 7 out of 7 people on this planet.
There's a lot of reasons for this surge that we're seeing in China, but also elsewhere. So as you know, some of the restrictions around the world, a lot of the restrictions around the world have been eased. And Omicron, the latest variant of concern, is the most transmissible variant we have seen so far, including all the subvariants that are in circulation, more than 500 of them. And so we will continue to see surges of infection around the world. The question is the impact. And we have seen a decline in the impact of COVID-19 over the last year, for sure, because we have population level immunity that is increasing. Now, clearly, what we need to do in all countries, including in China, to increase vaccination coverage in those who are most at risk, people who are over the age of 60, people who are immunocompromised with underlying conditions, and our frontline workers. And that includes receiving the full number of doses that are required for them. And until we see that, we will still see significant numbers of hospitalizations, ICU admissions, and deaths.
In July, I declared a public health emergency of international concern over the global outbreak of monkeypox known as Mpox. Over 83,000 cases have been reported from 110 countries, although the mortality rate has remained low with 66 deaths. As with COVID-19, the number of weekly reported cases of Mpox has declined more than 90% from the peak. If the current trend continues, we're hopeful that next year we will also be able to declare an end to this emergency. With no new cases since the 27th of November and no patients being treated at the moment, the countdown to the end of the Ebola outbreak in Uganda has begun. If no new cases are detected, the outbreak will be declared over on the 11th of January. With support from WHO, the government of Uganda is now focusing its efforts on maintaining surveillance and being prepared should there be any further cases.